Dear friends, dear colleagues, we are happy to share with you a new episode of our BG Dental Tips. And this time we will be speaking about trauma and a specific type of isolation. Let's go! So here you can see a very interesting case when the child, about 6 years old, fallen and broke central incisor. Actually, unfortunately, we didn't have the fragment of the tooth that that we can bond back. So we had to do a direct freehand restoration in that particular case. And ideally, in such a cases, if we want to keep vitality of the tooth and to make everything in a super precision, we have to make the isolation, because if you do bonding, direct composite, it has to be isolated. You have to follow bonding protocol. Everything has to be super clean, super dry, and then you can control the process perfectly. But the problem is that this tooth is not erupted completely, and you can see that the fracture line went a bit subgingival, and it's really challenging to do an isolation. And here is the trick. Look, what we can do. We can do etching and a little bit bonding before we place rubber dam on the buccal side and also on the palatal side, and then we put few drops of flow composite to the buccal and to the lingual side, okay, cure it, and this way we are able to have convexity, and then you put your clamp on, okay. So this picture was taken just immediately after rubber dam placement. Then everything was washed out, cleaned, and we started to do our direct restoration. This is how it looks like from the buccal perspective. You can see this kind of artificial excavator of the tooth that holds the clamp, but again, you have to edge, you have to bond, and then you have to place your flow composite in these cases, because if you just put flow composite, the force of the rubber dam clamp will break it up, and then you have no isolation, okay. So be careful, and by the way, be so kind as to put like to our video, to share this video with your colleagues, and to follow up us on our YouTube channel for more clinical content. Okay, so here you can see some steps of direct restoration that I performed that time, and then you can see the final outcome straight after rubber dam was removed. And here you can see a few years later the follow-up, the other teeth start to erupt, and I can show you even more amazing follow-up. So here is 2026. This is actually my son. That's why we have a super perfect documentation. He was 6 years old when he fell down in the school, and I did for him the direct restoration. And now this year actually we performed to him an implant because of the primary adentio on the lateral incisor. He didn't have this lateral incisor from the birth, so we managed the orthodontic treatment. So we created space, and then we put the implant, immediate implant placement and immediate loading. And you can see that adjacent central incisor, which is still in place, still vital, and still with the same filling, by the way, that I made long time ago. There is some light resorption of the root of the central incisor, but the still tooth is vital, everything works well, and we have an amazing follow-up because of many reasons. The reason number one is that we followed bonding protocol properly. We made a very good isolation with these tips and tricks, and for sure the restoration was done with a complete love from the father to the son. Maybe that's why this tooth still and the filling is still in place. Hope this trick will help you to isolate compromised teeth in your daily practice. And again, don't forget to put like to this video, and may the dental force be with you. See you next time.